Hi, I'm Alysha. I'm a psych nurse practitioner and I own my own private practice, and I teach other nurse practitioners how to find freedom and balance in their lives by starting their own private practices as well. Today we're going to talk all about filling cash-based practices. And I have some knowledge on this because I myself own a cash-based practice. And so before we even jump into tips and tricks with this, first I want to talk a little bit about the benefits of owning a cash-based practice and why someone may choose to be an out-of-network provider. Unfortunately, oftentimes we as nurse practitioners, psychiatrists experience this as well, and therapists. We find that insurance dictates how we can provide care, including like how long we can spend with the patient. We're locked in at certain rates, which typically can be fairly low, which drives practitioners to see more people in an hour. And sometimes there's even challenges with even getting reimbursed for your services. And so many choose out of network because they have the freedom to be able to see patients for a longer amount of time, providing higher quality care, practicing the way they want to, and getting paid for their services reasonably, adequately, and on time. So these are a few reasons. Of course, there's plenty of benefits to owning a insurance-based practice, and I cover that a little bit more in my cash versus insurance video, which I will link down below. But when you have made this decision to start a cash-based practice, let's get into some of the tips and tricks that I have. Number one secret isn't, I don't know if it's a secret, but it's having realistic expectations. And some of you watching this may know this already, and that is that a cash-based practice is going to grow slower than an insurance-based practice. If you think about it, a cash-based practice, you are doing all of your own marketing. With an insurance-based practice, you have so much marketing already done for you because you're in network, and that insurance is a steady stream of referrals. So it's going to take longer to build out your referrals, build out your marketing strategy, etc. with a cash-based practice. So the first tip is going to be, again, have realistic expectations. Do not give up too soon. Pick a strategy, give it 3 to 6 months, then change something. And so I think that a lot of times when people feel like their business failed, it's really more that they just didn't give it enough time. Cash-based practices, as I have covered, can be really wonderful, but it does take time to build. It takes time to get the word out there. It takes time to be a trusted referral source. And so one of the secrets to filling a cash-based practice, believe it or not, is just having realistic expectations and giving it time. My second tip to filling a cash-based practice is to be niched and highly specialized. And so I have said this in many of my videos, but if you haven't heard it before, most psych NPs think that they don't have a specialty or that they're not focused on anything specific, but really think about your top 5 favorite patients and what they have in common. Your niche and specialization, it might be something to do with your personal lived experience. It might be something to do with the patients that you love treating. It might be something to do with an area that you're trying to get more experience in. And so you're taking courses or you're learning other skills that make you specialize. That might look like, say, integrative psychiatry. You might be taking a course on learning that, and so you want to specialize in that. Something like a lived experience in patients you love working with might be that I can speak for myself. I worked at a children's hospital and I treated many cancer patients, and I myself have experienced cancer. And so when I was now in my private practice, that could be a niche and specialization of mine. Currently, I don't really niche or specialize in it, but it certainly could be. My niche and specialty is integrative psychiatry for teens and young adults, and I really like treating mood disorders and ADHD. So that gives you a little bit of an idea. So why is this so important? You might say, okay, yeah, well, I don't have a niche and who cares anyway. But think about it, you probably do have a niche and you probably are specialized in something. And the reason why it's so important is that when a patient is looking for services, If someone's in their network and they take their insurance, they're like, great, they take my insurance, I'll see them. If they're looking to go out of network, it's oftentimes that they're looking for something specific. They're like, you know what, I haven't been happy with insurance-based care, or I'm really looking for something specific that drives me to seek services outside of my insurance. And so that patient really wants to know that what you specialize in, they are having a problem with. And so if someone has felt like no one that they've seen has provided them holistic treatment or been able to talk to them about like alternatives to medication or using less medication overall, they may seek someone that's a holistic or integrative psychiatrist or nurse practitioner. And that will make them, when they see that specialty on your website, that's going to drive them to book, because they're going to say, oh my gosh, this is worth it because this person specializes in what I need. For example, say you injured your shoulder, maybe you're an athlete, and you're looking for an acupuncturist. You're going to want to go to an acupuncturist that specializes in sports injuries. So it's the same when people are looking for mental health care. For an example, if someone is looking for an ADHD specialist because they feel like they are noticing symptoms in themselves, and so they're Googling, ADHD specialist, what it won't drive them to come see you if your website just lists ADHD among 30 other conditions that you treat. This is why specializing and why communicating your specialty can be so important in a cash-based practice, because that is what is going to communicate to the patient that you really can help them. And it's also going to make them feel more comfortable with going out of network for your services, because it's something that they feel like they have not been able to find. Kind of a win-win scenario, right? Good for the patient, positive for your business, and positive for you because you'll be treating patients that you really love working with. Number 3 is going to be building strong referrals within your community. And I'm not saying community like down the street. If you are opening a private practice in Arizona, that could mean anywhere in the state. It could mean down the street from your office. It can mean other people that specialize in what you do. Think about where your patients are hanging out. Do you specialize in sports psychology and medication management for athletes? You might be networking with the local gyms. That's kind of an interesting example. Or more of a common one, you might, if you treat anxiety and depression, you may be networking with anxiety and depression therapists. Think about where your patients are spending their time and who other professionals that they're probably seeing that can identify that maybe they should see you. So if they're seeing, say, a sports acupuncturist, but they're saying, they're depressed and they're sad because they can no longer perform at the level that they did before, the sports acupuncturist might say, hey, I know someone that maybe could help you with your mental health in this arena. So this is how community referrals work. And so in my full private practice mentorship program, we talk a lot about this, on how to identify good referral sources, how to have a marketing strategy, and how to foster those relationships with your referral sources. And so that can be really, really valuable. And that's honestly something that we talk about most commonly in my mentorship group. We have a live component to it, so we talk about this very, very often in our calls that are every other week. There are also videos on this, and you can post anytime in the community forum in my course and mentorship program. But the most common time that we talk about this is in the group calls. It's really, really important to get the word out, and marketing can be quite challenging for cash-based practices, but with the challenge comes that it can really, really be a game changer for filling your practice. This was huge when I finally was able to identify really good referral referral sources. And that really was a game changer for my practice. And number 4, it's more, not so much a tip, but an encouragement. And that is, I want to encourage you that there are an abundance of patients. This is not oversaturated. If you offer the similar services to someone down the road, that just means that there is a need. And more importantly, there is a need for you. You and your personality and your skill set. There are people right now Googling trying to find a practitioner just like you. And so I want to encourage you, if you're feeling really overwhelmed about starting a cash practice, or if you just started a cash practice, you feel like it's getting nowhere. I want to encourage you that there are people out there that are looking for a psychiatric nurse practitioner to care for their needs. And that psychiatric nurse practitioner has the skill set that you have. And so please do not give up. Building a cash-based practice can be really, really challenging. You are not going to have people come in and banging down your door, in the first couple of months, but give it time, build out those referral systems. I really wish you the best, honestly. And so if you feel like you need some support, I welcome you to take a look at my masterclass and the application for joining my program. I would be happy to support you and guide you in this. Of course, there are so many more things in this arena that can't be covered in a video, but take a look at the link below. I'd love to have you, love to hear from you. And as always, happy practice building.